Today, we're going to break down a pretty bold vision for completely overhauling America's health system. This is all based on Robert F. Kennedy Jr.'s proposed plan for the Department of Health and Human Services. So let's dive right in.
This right here, this quote, is really the starting point for his entire plan. The main goal he lays out isn't just about treating symptoms, it's about fundamentally figuring out and stopping what he calls the chronic disease epidemic that's crippling the country. This one question, why are Americans so sick, is what drives his entire agenda for reform. So first up, just how big is the problem as he sees it? This section really lays the groundwork for the crisis his whole plan is trying to solve. He kicks it off with a pretty staggering statistic, to be honest. 77% of young people in America are not eligible to join the military. And the main reasons aren't what you might think. It's health issues, things like obesity, asthma, and diabetes. He doesn't just frame this as a health crisis, but as a genuine matter of national security. This slide really gets at the paradox at the heart of the U.S. system. According to his analysis, America spends way more on healthcare per person than any other developed nation. We're talking 2 to 3 times more. But, and this is the crazy part, our health outcomes are worse, and our average lifespan has fallen years behind everyone else's. The big point he makes is that all this spending isn't actually buying us better health. And to put a price tag on all this, he draws a pretty stark contrast between then and now. He says that back when he was a kid, the U.S. spent basically nothing on chronic disease. Today, that number has exploded to $4.3 trillion a year. That's trillion with a T. He calls that number completely unsustainable and says it's the reason we need radical change. Okay, so that leads directly to his next point in Section 2. He argues that if our health is in such a crisis, then the problem must lie in the very systems we're supposed to trust for answers, our science and our government regulators.
One of his first targets is the scientific publishing world. He argues that top medical journals have become, and this is his phrase, propaganda vessels for the pharmaceutical company. He even points out that former editors of huge journals like the New England Journal of Medicine and The Lancet have said similar things about corporate influence messing with the science.
So what's the fix? Well, his solution is all about radical transparency. He wants to create something he calls open source science. What does that mean? Well, first, it means publishing the peer reviews, the secret critiques from other experts, so everyone can see them. Second, it means making all the raw data available so any scientist anywhere can double-check the work. He also goes after the incentive system in science itself. The way he describes it, a scientist's whole career depends on getting published. But journals often want to publish positive results, studies that find something new and exciting. This creates this huge pressure to manipulate data, because if your study doesn't prove your original idea, it can be a dead end for your career.
And he gives a really powerful example of where this can lead. About 20 years ago, a huge study came out claiming amyloid plaque was the cause of Alzheimer's. So for the next 2 decades, billions of dollars and hundreds of studies went down that rabbit hole. But it turns out that original research was exposed as fraudulent. That's a massive scientific dead end that cost us so much time and money.
So to stop that from ever happening again, he proposes a really simple but dramatic new rule. Take 20% of the entire research budget and dedicate it to just one thing: replication. By systematically redoing studies, he argues, you create a system where you're just much more likely to get caught if you cheat, which should restore some integrity to the whole process.
This brings us to Section 3. If the science has been flawed, then what does he think are the real causes of chronic disease? Well, his focus shifts directly to our environment, and specifically our food.
He uses Fruit Loops to make his point, which is pretty easy for anyone to get. The version sold in the US is, as he puts it, loaded with chemicals, like artificial food dyes that are banned in Europe and Canada. But the same company makes a totally different, cleaner version for the Canadian market. He uses this to ask, why are US regulators letting this happen to Americans?
So his agenda here is pretty clear and direct. He's calling for a ban on these food dyes, helping farmers switch away from controversial pesticides like glyphosate, taking a look at fluoride in drinking water, and just completely redoing the dietary guidelines, the old food pyramid, to make sure it's based on independent science, not corporate lobbying.
Okay, so if the government's role is to clean up our food and environment, what's the role for us, the individual? Well, Section 4 is all about policies designed to empower patients.
He bases this entire section around a quote that he attributes to President Trump. The whole philosophy is to give people the tools and the information they need to take control of their own healthcare choices, so you can go from being a passive patient to being an active CEO of your own body.
And to show why this is so needed, he asks a really simple question. If you were having a baby in New York City, how much would it cost? The answer, he argues, is you have no idea. And that lack of clarity is the whole problem.
He points to data that shows within just a 1-mile radius in Manhattan, the price for having a baby can go from $1,300 at one hospital to $22,000 at another. He argues this huge difference for the exact same procedure is only possible because we, the consumers, have no clue what the real prices are.
The solution he's pushing is simple. Actually enforce price transparency. He imagines an app, kind of like GasBuddy for healthcare, where every single hospital has to publish its price for every single procedure. The idea is to finally introduce some real competition into the market, which he thinks will naturally make costs go down for everyone.
Let's move to our final section, which is all about tackling the system's messed up financial incentives that he believes keep people sick and costs high.
He starts with a really stark figure, $100 billion. That's how much he claims is just flat-out stolen every single year from Medicare and Medicaid through fraud. He calls the old system for fighting this pay and chase. The government pays a suspicious claim first and then tries to chase down the money later, a process that, surprise, almost never works. His new system would use AI to spot and block fraudulent claims before a single penny ever goes out the door. It's about stopping the crime before it happens. In this quote right here, it gets to the absolute heart of the incentive problem. Using the example of drug rehabs, he points out that the system often rewards failure. If a patient relapses and has to come back for more treatment, the provider makes more money. He argues we have to flip this completely so that providers get paid for successful, long-term outcomes, not for repeat business.
And that leaves us with this final, really provocative question. His entire plan is built on this idea that the current system, from the food we eat to the science we trust to how we pay for care, is financially set up to benefit from sickness. So if that's the case, how does that change the way you think about managing your own health?